Good day. This is Jed Shlackman. I'm a holistic psychotherapist and spiritual energy healer here in Miami, Florida. And in this discussion, I'll be talking about disease care versus health care. This is a look at the paradigm of how we deal with health concerns, what approaches use, what philosophy or basic worldview is underlying those approaches to treatment. So if we examine different aspects of a disease care approach versus a health care approach, we'll see a significant difference in the understanding of health and illness, or health and disease, and as a result of that, some substantially different approaches or ways of addressing those concerns. I'll be using in this presentation a chart which outlines two different paradigms and the basic assumptions that they employ. And that chart is based on information from a book called Immunization: The Reality versus the Myth. In the disease care paradigm, there's an emphasis on just treating or removing the symptoms. So you're looking for some type of intervention that will get you a quick result, the symptoms disappear, and at least temporarily the person may be feeling better. A healthcare understanding, one that looks at things holistically, emphasizes removing the causes of whatever the illness or symptoms might be through knowledge and its integration into one's living habits. The aim is for long-term results. On the disease care worldview, you have an emphasis on management and control. So people go to professionals who are there to manage their condition, and the patient basically just follows orders or follows the prescription of what those professionals are telling them. On a more holistic healthcare perspective, it's more about helping the patient improve their own health, so you emphasize the patient's own participation in recovery. As a professional, you're giving some guidelines, giving some information and resources, but it's really up to the patient to direct their own course of therapy. You're not imposing it on them, you're offering what's available, you're sharing your knowledge and resources for the patient so that they can understand things and they can take appropriate action. The disease care model would tend to rely more on assembly line type methods that are geared for profit, and we see that to a great extent with the pharmaceutical industry. So they're creating patented medicines, and so with a patent you can make a lot of profit, and you also have a very standardized form of treatment. So you have a pill that contains certain chemicals in it, and everyone who is given that pill is receiving those same chemicals, the exact same treatment, even though they're all different individuals, different people who may be having different factors that are contributing to their symptoms. You're just giving a one-size-fits-all treatment. Now, with a more holistic healthcare oriented model, it's about relying on more harmless, non-invasive types of therapies, using things like food and nutrients, using herbs, using energy-based therapies, spiritual or psychological types of treatments. So there you're trying to help the person without doing something that could actually harm them. So that's a client-centered approach. You're helping that person be autonomous, helping them do things on their own that are going to boost their health and well-being. In the disease care allopathic type medical model, you're relying a lot on technological intervention and substitution. So as an example, you have organ transplants. So if an organ is malfunctioning or damaged in some way, rather than finding a way for the body to regenerate that organ, they're just cutting it out and putting in some type of transplanted organ or artificial organ. You get things like insulin injections, surgery, radiation, chemotherapy, synthetic drugs, vaccines. So you're creating a dependency on something that's external to that person. Now that's a profitable model if you're in the industry of providing those external aids for the person to be able to survive, but for the person it takes away their autonomy. In that sense, this disease care model tends to be cost and dependency escalating. We see that here in America with the continually rising costs of health care. So the people in general are not healthier, but the cost continues to rise higher and higher. In the holistic health care model, you'll notice a tendency toward cost and dependency de-escalating. So you're giving the person resources to manage their own health, to keep themselves balanced and healthy so they don't need to keep returning to the doctor or going to a hospital or buying more synthetic drugs. They're using things that exist in nature in order to maintain their health. So in that model, you would see the costs going down. Clearly that's not the major model that's been integrated into the American healthcare system, but it is a model that has been used traditionally in many other cultures. In the disease care allopathic type of model, the disease and disability are seen in terms of kind of a victimization and melodrama. So it's the idea of, oh, these people are being afflicted by cancer, or these people are catching this particular infectious pathogen. And you have medical dramas of how are we going to fight this. So that's the mindset that tends to be projected both for the medical profession itself and for the general public. In the holistic approach, in the health care model, what happens is we see disease and disability as something that's normally preventable. So if we take care of our body, if we reduce stress, if we nourish ourselves properly, then we're not going to catch those infectious illnesses. We're much less likely to come down with cancer or heart disease or other common catastrophic illnesses. In the allopathic type disease care model, things are looked at in a more mechanistic way. The body is seen as a mechanistic organism. It's an object that has discrete parts that can be treated separately from one another. You have specialists, doctors who treat specific parts of the body. In the holistic approach, in the health-oriented model of care, things are seen organically and holistically. Your body is seen as a mass that's actually underlied by energy, living patterns, habits, consciousness. So nothing is actually separate from the whole. you're treating the whole person rather than just trying to address symptoms or focusing on one specific part. Now, in the disease care allopathic type model, we also have the understanding of things being fragmented. So the mind and body and spirit, in a sense, are treated separately from one another. As we mentioned in the holistic, health-oriented model of care, everything is seen as part of a unified whole. So you would consider every aspect of that person, their thoughts, their emotions, their feelings, their energy system, all of that contributing to what's happening on the physical level. In the model that uses allopathic approaches, the disease care model, the illness or disease is often labeled as something that's separate from that individual, separate from the person. So it's like an invader that's attacking them, not something that in some way they have helped create or manifest. In the holistic, health-oriented model, we can see that the disease is actually a process that's inseparable from that individual person. So the cancer does not exist separately from that person. It's actually a process that's going on within their mind-body system. As a result, the holistic model tends to understand the symptoms as feedback, something that we can learn to understand to help guide our treatment, rather than something adversarial that we need to fight and attack in some manner. Thus, the disease care model externalizes causality. So it says that some pathogen, some microorganism is attacking your body, and that by itself is the reason you're becoming ill. Or perhaps there's something in your genetics, so some corrupt gene that's causing you to become ill. In the health-oriented holistic model, the causality is seen more internally. The focus is more on that person's choices, their attitudes, their habits, their ways of coping with their environment. So it's empowering the individual more, rather than placing the blame on something external that you may not have control over. In the model that works with allopathic medicine, we see things are disease-oriented in the sense that you're giving a label or diagnosis, you're attempting to control or destroy what are perceived as disease-causing entities. So there's more of a focus on the symptoms than there is on the causes. The holistic approach, the health-oriented model, focuses on the support of natural healing, working to build up the person's immune system to find what are the root causes of a condition. And when someone does not have a disease or illness, that's just naturally how it is when you're healthy. So focus in that case is on being healthy rather than focusing on and trying to attack or suppress the disease state. You'll notice in the language or semantics that are used in the disease care approach, it has a militaristic tone to it. So there's talk about fighting, battling, going to some kind of a war against cancer, a war against AIDS, etc. In the holistic approach, the language is more descriptive and it focuses more on harmony and cooperation. So it's about finding balance, finding wholeness, restoring equilibrium. So it's working with the system to bring itself into balance and well-being. The disease care philosophy tends to be a negative worldview. It's built a lot on fear and distrust of the natural world, while the holistic model is actually one that encourages us to find balance and cooperate with the natural world, to use things in nature like sunlight, like water, natural foods, fresh air, etc., in order to bring ourselves into wellness. The implications of these paradigms are really profound. If we use the allopathic medicine model, the model that has us kind of at war with nature, blaming everything on something outside of ourselves, then we give away our power. We become dependent on alleged experts or authorities who use technological interventions, things that are often very costly and expensive, in order to identify what we think might be wrong with us and apply some type of treatment to address those symptoms. In the holistic approach, we're empowering ourselves. We're understanding how our lifestyle, how our thought patterns, how our habits are affecting our well-being, and we're learning to manage things ourselves. We're not becoming dependent on a supposed external authority. We're taking power over our own lives, our own health and well-being, and we're just using the professionals who are giving some support or guidance or therapies as tools and aids to help us. We're not letting them dictate things to us. We're partners in this journey toward claiming our health. I appreciate each of you for taking the time to listen to this presentation. For those that would like to learn more, I encourage you to visit my website at www.phinsights.com. That's PHINSIGHTS.com. You can also find me on Facebook as Jedi Holistic Healing. Once again, it's been a pleasure to share with you.